Hello everyone, Dr. Kainat here, and today we are going to talk about gastrointestinal drugs. As the name indicates, gastrointestinal drugs are those which are going to be used for the gastric and intestinal issue. So before continuing the drugs, we should know about the pathophysiology of our stomach. So stomach cells and the glands release different types of things like hydrochloric acid, bicarbonates, pepsinogens, intrinsic factor, mucus and prostaglandin. So we are going to discuss all of them one by one. The main function of hydrochloric acid is, first, it provides the acidic medium for the enzyme to work best, and the second, it is a barrier for the infections. Like if some microbes are going to enter into your stomach with the food, then the HCl is going to kill them. Second thing is the bicarbonates. Bicarbonates are the natural bases that are present and they neutralize the stomach acid. The next one is the pepsinogen. Pepsinogen is pepsin, so it is required for the digestion of our protein molecules that we are going to eat. The next one is the intrinsic factor. Intrinsic factor is a glycoprotein that facilitates gastric absorption of vitamin B12. The next one is the mucus. Mucus protects the stomach walls from the acid and from the HCl acid like hydrochloric acid and the other enzymes. The last one is the prostaglandin. Prostaglandin serves as a variety of anti-inflammatory and protective functions. So this is all about the pathophysiology of stomach. Now we have to talk about acid-related diseases. There are three main diseases: PUD, peptic ulcer disease; GERD, gastroesophageal reflux disease; and the third one is the Helicobacter pylori. So these are the three types of the gastrointestinal issues. If H. pylori is present, it will cause duodenal ulcer or intestinal ulcer like the GI ulcer. So main basic thing is, whenever we are going to treat this type of ulcer, we have to use combination therapy with the gastrointestinal drugs. So let's move toward our drugs. So the first drug are the antacids that are going to control our acids. So antacid is the first one. Second one is the H2 antagonist. Third one is the proton pump inhibitor, mucosal protective agent and prostaglandin. These all drugs are going to control the acid. These are the acid controlling agents, you can say. So the first drug is the antacids. Now we are going to discuss the first class. So antacids are the drugs that are not going to stop the production of acid. What they have to do, they are weakly bases, so they are going to react with acid and neutralize it. Whenever acid and a base react with each other, neutralization reaction happen. They are going to produce salt and water. In the same way, this thing happen here in the stomach. Whenever we are going to intake it, the antacids, they go into your stomach, and all the acid that is going to be produced in your stomach, already present in your stomach, they are going to neutralize it. They are not going to stop the production. So remember this thing. So we have the different types of antacids like ammonium antacid, calcium antacid, magnesium antacid, sodium antacids, and they are present in the form of the salt. So we can use the hydroxide or the carbonates. Like here is the first example, ammonium salt. So we can use both ammonium carbonate and ammonium hydroxide. But we should know about their side effects too, because their side effects are very important. Like ammonium can cause what? Ammonium causes constipation. So we can't use in those patients which has constipation issue. So ammonium salts are going to be used with the magnesium combination. Why we have to use with the magnesium combination? Because magnesium always cause what? It can cause diarrhea. So if we are going to use aluminum or magnesium separately, they can cause the side effect like constipation and the diarrhea. So the combination is the best one. Like we are using here in the market the Gaviscon. Gaviscon is the important one because it's a combination of calcium and ammonium and magnesium. The next are the magnesium salt. As I told you, the first side effect, they can cause diarrhea, but the second side effect is if the person have the renal issues or renal failure issue, so what is going to happen? Magnesium is not going to excrete out from your body, and it causes what? It can cause hypermagnesemia. Next one is calcium salts. Calcium salts are also very important, but still they have side effect like constipation. And the second important thing, they can cause kidney stone. But there is one advantage of calcium salt, because they can be used as an extra supplementary agent in the body. The next one are the sodium carbonates or sodium hydroxide. These are going to be used, but we can't use in the patient which have the renal issues, which has the hypertension or heart failure issue or any issue of the heart or BP, blood pressure. So we can't use sodium salt in that one, sodium antacid in that patients. Sometimes what happen, flatulence is going to happen because of some of the antacids, like the calcium antacid can cause flatulence. So at that time we have to use antiflatulent agents in the patients with the combination of antacids. Antiflatulent agents are going to be used with the antacids. So the best antiflatulent acid is activated charcoal or smethicone. What they do, they are just going to break the bubbles that are going to be produced that can cause the gas issues. And this one antacid that cause this issue, like the flatulence issue or gas or bleaching issue, that is the calcium carbonate. So we always recommend that whenever you are going to use calcium carbonate antacid, at that time you have to use smethicone or activated charcoal with this. This is all about antacids. So if you got any question, you can ask. Next cases are going to be discussed in the next video. Thank you. Take care. Bye.